Hello, I'm Dr. Sanjay Panicker. When you have a patchy hair loss, the most common thing which patients do is that they try to apply something which they would have heard will help the hair to regrow. Because it's sudden situation, suddenly they come up with, they notice that there is a patch formed on scalp and there's a patch of hair which is fallen off. So it happens within a short period, like 1 or 2 days, 2 or 3 days, they have a patch which forms. So then they're worried, then they talk, and then people tell you apply this, you apply that. So many patients, you have a habit of applying onion juice. This is a very common thing which is going around where people say apply onion juice and the hair will grow back. But onion juice is an irritant, and many cases come to me where applying onion juice has led to scarring. And when there is a scar in any area, let's say you've fallen, you have a scar in that area. In that scar area, the hair doesn't form, doesn't grow back. So let us say by chance it got burnt, because onion is an irritant, and if it got burnt because of applying the onion juice, then you may not get the hair there in that particular place. So when you apply anything, there is high risk that you may scar the area. So be very careful about it. Not that if it's diluted in a particular way, extracted, and then now onion hair oils are there. It's quite good. Instead, why do you want to apply direct onion on your scalp? You can use something which is safer and tested. So that you apply, that will help you. Why do you want to directly apply and cause any irritation there and burn, and then hair doesn't grow at all? So now there are two types of alopecia areata. This patchy hair loss is called alopecia areata. That can be a scarred alopecia areata or non-scarred alopecia areata. Initially, most cases are non-scarred, that is, there is no scarring, and we often apply something and cause a scarring. That is the first condition where it may become scarred. Second condition where it may become scarred is when that area is infected with some organism, like in tinea capitis, where there is a hair loss which happens in patchy area. Because of that infection, the hair is lost in that area, then leads to a scarring subsequently. It can also be an autoimmune condition, like it happens in scleroderma, or it can happen in SLE, or various other conditions where the patchy hair loss can happen with a scar. So when there is a scar in that particular area, it will not grow back. The hair will not grow back. But it is important for the doctor to assess whether it is a scarred alopecia or non-scarred alopecia. If it's a non-scarred alopecia, don't worry, you don't need any application. It will usually grow back in about 3-4 months at the most. And in some cases where there are hormonal issues, let's say there is thyroid, there is PCOD, and somewhere the hormones are affecting the hair, then in that case the hormonal issue has to be tackled. Otherwise, one patch will go, another patch will come, another patch will come. It's a never ending. The problem in alopecia areata, which is not scarred, is not that it is difficult to grow back the hair. It will anyway grow back. But the problem is recurrence. How are you going to prevent a new patch from coming, another patch from coming? Usually most of the cases of alopecia areata come to me in the cold weathers, like rainy and winter. Now, why is alopecia areata coming up in that particular season only? Many cases come up during that time. Why? Now, usually the immune system builds up in this cold weathers to protect you against bacterial and viral infections. At that time, some abnormal immune cells, which is wrongly thinking that your own hair follicle is a bacteria, is also released. So which goes and attacks the hair follicle, and that's how the alopecia areata patch comes up. That's a patchy hair loss. But there is no scarring. It will again grow back after that particular damage is over. So you need not worry about alopecia areata unless and until it is not spreading. Let's say one patch come, another patch come, another patch come, then it is a worrisome. Then you need to do something about it. One patch comes, it usually heals off. But if it is many patches, then you need to tackle it. Or if the patch is increasing in its size and affecting the whole scalp, then you need to worry. Or if the patch is involving behind the ear, this particular pattern, it's called as an ophiasis pattern, like the hood of a snake. If you find that, then you need to worry, because in those cases the hair is difficult to grow back. In any such condition where you feel that anxiety, meet a good hair specialist. He'll be able to deal with your case and tackle this issue. If there are hormonal issues, the hormonal issue has to be tackled. In scarred alopecia areata, it is important to identify the extent of scarring And wherever the scarring is very severe, we should not expect too much hair growth to happen. Though some non-scarred areas which we may not observe may pick up. But the totally scarred areas usually does not come up. In conditions like lichen planopilaris, which is a type of a scarred alopecia areata, where the patchy hair loss can happen, in that condition, the disease spreads very rapidly. In a short span itself, in about 6 months, 1 year, the entire scalp may get affected. And if you find that it is spreading very rapidly, you must arrest that autoimmune process, and that can be done with homeopathic medicine. You can arrest the progression of the disease, but it will take some time to arrest that. Minimum 3 to 6 months, or maybe some cases even 6 to 10 months if there is some hormone in background. Let's say if there is thyroid in the background, definitely it's going to take more time. When you have thyroid, it's like diabetes is there for the skin. Thyroid does similar things for the skin. It delays healing, doesn't allow the body to heal fast. So you notice that the patients don't respond so fast. In that case, tackle the root cause and then treat this alopecia. Patchy hair loss, as in alopecia areata, you will see a response any which ways with or without treatment in about 3 to 4 months. Usually the hair grows back in about 1 or 2 months, or sometimes 3-4 months. It will anyway grow back. You may not even need a treatment. But let's say you're getting many patches, or if the patch is increasing, then you tackle the root cause, and if there is no hormonal thing noticed, the case will anyway improve within 6 months at the most. Improvement starts happening within 3 to 6 months, and in 6 months usually the patch is covered. But if there is some hormonal issue or some other factors which is there in the case which is blocking the progress, then that root cause has to be tackled, and then automatically the alopecia areata gets covered. But if it's a scarred alopecia areata, or if that is ophiasis pattern, that's a patchy hair loss behind the ear, in such cases the duration of the treatment can get longer. If it is telogen effluvium, as which happens in hair loss which happens post illness, like after COVID, now many people had severe hair loss issues where they started losing hair in bunches. When you find extreme hair loss after an illness, or after certain phases in life like puberty, post-delivery, menopause, you see many women lose hair after the delivery. So that kind of a hair loss will usually come back. It's not a permanent hair loss. That shedding which happens after illness usually comes back. But in some cases, it goes into a chronic phase. So there are two phases in telogen effluvium: acute telogen effluvium and chronic telogen effluvium. Chronic means long duration. If it is not resolving even after 6 months, 10 months, not resolving, then it is going into the chronic phase. So in that case, you need to correct it with some homeopathic medicines. There is some change in the gut bacteria, microbiome in your intestines is somewhere got altered, so the nutrition is not reaching the body, or it could be deficiencies which is directly happening because you are not consuming enough nutrients. Either of these reasons, the body has become a bit weak due to the illness, subsequent to which all these things are happening. So correct that nutritional factors, improve the health of the person, and then automatically the telogen effluvium issues start getting resolved.